Joining us on 710 KURV, we bring back to the show our local infectious disease expert is Dr. Michael Jelenik. Dr. Jelenik, welcome back to the show. Now that we hear that, according to this press conference yesterday, this conference call that they had, and everybody talking about the fact that the patient, Thomas Duncan, may have been out in the open for several hours in the ER, exposing God knows how many workers. Do you expect perhaps a few more Ebola cases to be tested positive up in Dallas?
Yes, I do. I do expect that we're going to see a lot more cases. Well, at least a few more cases.
Mm-hmm. Within their staff, probably. More than likely just within their staff.
Hopefully, yes. But
okay.
They're learning more and different things about this virus every single day. The epidemiology that we spoke of last it's still not completely clear how easily this is transmitted. And I think one of the major networks reported that the volume of virus in secretions, like a drop of blood, is 1,000 times more than HIV with the Ebola. So that would explain certainly some of the reasons that this is much easier to get than what we were first led to believe.
Ms. Cortez with the National Nurses United said that we are so ill-prepared as far as training and equipment at many hospitals across the nation, and all it takes is another patient showing up at another hospital, I'm guessing, and we might have another little minor outbreak like that. In your mind, what needs to happen? For that part of the country, that's fine, but what needs to happen here with us at our major hospitals right now for us to play proper defense?
For us to play proper defense, we have to continually retrain everyone in the hospitals to be prepared for Ebola patients. And that means really going through infection control protocols and adhering completely to all the recommendations that have been made. And infection control has always been something that hospitals have had, but this is an unprecedented outbreak. This is something that really has not been seen in this country with any other disease.
Definitely putting us to the test.
Uncharted water.
Yes, sir. Putting us to the test right now. Dr. Michael Jelenik, infectious disease expert here in the Valley, joining us on 710 KURV.
Yeah, Dr. Jelenik, Tim Sullivan here. Yeah, you're right. We haven't seen Ebola in this country yet, but for many, many years, there was always the prediction that eventually, yes, it would come here. Again, I'm asking, why have not we prepared, I guess, enough for the eventuality that we are now seeing?
I think that most of the reason for that is that the level of transmissibility of the disease was not clearly defined. And since it was thought to be harder to acquire this disease, there was less of a preparatory effort made on the part of infection control systems nationwide. And the CDC, in my opinion, was not prepared for this. I mean, they're prepared for patients under their direct care, and 4 hospitals in this country are prepared for Ebola, but general hospitals are not, and I can't really fault them for being unprepared because of the lack of knowledge of how well this is transmitted, how easily this is transmitted, how the volume of infectious particles and secretions, etc.
Do you support or do you agree with the concerns and complaints now being voiced by the nurses' unions? Are they right? Are hospitals in Texas ill-prepared to deal with Ebola?
It's not just Texas. This would happen, I'm sure, in any of the states. I think the only exceptions would be the states that have the 4 centers: Missoula, Montana, Emory, Nebraska, and I forget which one is the 4th. But
we don't have a contingency plan right now in the Valley to properly address this if it were to suddenly show up at one of our ERs right now, do we?
I don't believe we do.
Is there anything being done about it?
Yes, the Texas Department of Health is convening a task force on this. And
they don't meet till next week.
No, it's this week. It's tomorrow.
Okay. Very well then. Dr. Jelenik, thank you. We'll keep in touch. Dr. Michael Jelenik joining us on 710 KURV.